So this is going to be pretty brief tonight. I just have a few things to go through with everyone. I thought I would start with a recent drug shortage that has probably come across most folks' radar, but if not, it does turn out that there is currently an amoxicillin shortage going on right now. It has been officially declared a shortage by the FDA. It is impacting both tablets as well as suspension, and it's across all of the major suppliers that you see listed there. The current strategies that most are using right now is the quote on allocation, which means that they're kind of just rationing out a little bit at a time to try to, keep some continued supplies. The last that I've heard, the formulations are still available, but it may not necessarily be at the initial pharmacy that a patient goes to. They might have to kind of go and check a couple of different places. And it's thought to be due to increased demand. And I've got a slide coming up on this in just a few minutes, but with the increase in respiratory infections, as we all know, amoxicillin is not going to be effective if it's viral, but it is being used a lot, particularly with RSV patients, if there's any sort of secondary bacterial infection. What I have not heard, and I'm interested to hear from all of you shortly, is if there's any call for any compounding of these formulations to help our patients. The second thing, which also I think hit yesterday or today, is the almost $14 billion settlement for opioid claims across 3 major pharmacy chains. The information that I saw yesterday indicates that CVS will be paying $5 billion over 10 years, Walgreens 5.7 over 15 years, and Walmart at 3.1 billion. And it looks like that may be upfront, but not certain. And also, some of you may be aware that San Francisco has a separate trial versus Walgreens specifically, and they are not included in this settlement. I don't have great information yet on where all of this money is going, although some of the quotes I've seen from the legal team pursuing the settlement said that this money is going to go back to the communities to help with opioid abuse resources. Okay, so moving on, I also wanted to make you aware of some updates in testing recommendations for COVID-19. So I put this diagram together yesterday, and I think it has a lot of room for improvement, but I just will try to walk you through it. So, and these are for the home test. So the antigen test that many of us, like I have some of these at home, I'm sure you may have them or your patients may have them. So we start in the middle with a little block that's outlined in yellow. So you take your COVID antigen test. And if it's positive, then you follow all the typical recommendations with quarantining, etc. However, if it's negative, the recommendation now is that 48 hours, if you still have symptoms, you repeat the test. And if that one's positive, then you go back to follow the same recommendations. But if the second test is negative and the symptoms continue, then you can consider repeating the test a third time. This is on the FDA's website, and there's a link to the CDC website, which sort of kicks you over to the FDA recommendations. And the thought process behind this is because the home tests are about 80% accurate in picking up the antigens. So there is some chance that they may be missing it. And many of you may either have yourself experienced or have spoken to people who have had very classic symptoms for COVID infection, but have reported testing negative. So now there's the recommendation to consider repeating the tests. Yesterday, I was asking some colleagues, like, why aren't we hearing more about this? And there's some thought that that might, in fact, be a little bit politicized in nature, just because the government is no longer supplying free tests. So if we're telling people to test multiple times, there could be a cost incurred by them. So moving on, we are now in a declared health emergency in Orange County from the respiratory syncytial virus infections. The rates of admissions are substantially higher. So As you see here at CHOC, just this past month, there were 285 kids admitted versus about 188 at this time last year. There also are admissions with children that are a little bit older, like kids 4 and 5 years old, as opposed to really young infants. And just to quickly remind you, the natural history, most kids get RSV more than once, even a good handful of times, and eventually they develop immunity. And the thought is that because we're coming out of a pandemic and a lot of the really young children have not really been out and about and exposed to others, they have not really had a chance, or not even really young children, like all kids, up to birth up to like kindergarten age, never really had a chance to develop this immunity. So we're seeing a just dramatic spike in these infections. And then, you may have also seen things in the news where we're talking about like a triple, a tridemic, where we're seeing RSV, flu, and also COVID infections going into the cooler weather months. The medications that are available, there's Synagis, which is typically given to babies who were born prematurely, obviously after delivery, to help prevent RSV infection. There's a few other qualifying criteria. That's typically administered on an inpatient basis. And also there are some vaccines. I would like to point out on the slides, the vaccine that I can definitively say is in phase 3 trials is the Pfizer vaccine. And this is a vaccine that's given to mom in late 2nd to 3rd trimester, kind of like we think about for the Tdap vaccine when women are pregnant. And the idea is that confers some immunity to the baby. And they have some data showing that it actually reduces RSV in infants. Numbers, I've seen numbers in the high 80s% for infants up to 90 days, and then about 60% for infants up to 6 months. So it seems to be pretty effective in helping protect babies from RSV. GSK, for example, I cannot confirm that that is in phase 3 trials, so that's, I don't want you to infer that from the slides. That is targeting RSV infections in adults over the age of 60. So again, thinking about preventing RSV infections in another potentially vulnerable populations. So that's those are a few items that I thought I would share with all of you. Now I'm curious to hear, oh, thanks, Jennifer. GSK is in phase 3 as well. So thanks for confirming that. That means the slide is not a typo like I thought it might be. What are you all seeing in your practice? I mean, are you seeing, do you have amoxicillin in all the strengths on your shelves? Are you able to still provide that for your patients? Are you hearing these things about the COVID tests?